I'm Karen Lemke. I'm with the Rochester Public Library. I'm here to talk to you today about some of the resources that are still available at the library, even during this ongoing health crisis.
And let's start by talking about the City of Rochester COVID-19 Information Hotline. If you have any COVID-19 related questions, staff members from the City of Rochester Public Library are available to answer the phone and answer your questions. That number is available Monday through Saturday, 9 a.m. to 7 p.m. at 328-2822. The questions that come into that hotline do vary, but they're answered by teammates from the library, like my colleague Kim here. She works in the call center with a number of other library staff members who have been taking calls since this health crisis started. On the busiest day so far, they had 320 calls that were answered by library staff. And again, that number is 328-2822. Now, in addition to answering phone calls that are COVID related, we also have virtual assistants from library teammates who answer library calls. And again, those phone calls are staffed by teammates working out of their home, and that's from 9 a.m. to 7 p.m. Library staff can answer questions about anything library related, or just regular reference questions. So if you have a question about your library account, a question about how to place holds, if you're curious about services that we are offering at this time, you can always give us a call, and we will have staff members who are available to take those questions at this time. At the end of April, we launched our curbside pickup service. This service allows individuals to stop by the library and pick up items that are on hold. There's no need to leave your car. We have staff bring the items out to your vehicle. Individuals who are interested in this service should know it is popular, especially on Mondays. And so just be prepared. When you pull up to the curbside, you are given a number to call, and then staff will bring your items out to you. Thursdays tend to be slower, but they are also still rather busy. In addition to our curbside service, we are starting to offer internet services inside the library building. Internet services are available by appointment only from 1 p.m. to 6 p.m. Monday through Saturday. We do have a very limited number of computers available and very limited, if any, staff assistance available because we do want to maintain that social distancing. If you're interested in getting holds but don't want to come down to the library, don't want to have to brave the traffic, you can stop by the Bookmobile. We are offering holds pickup services at the Bookmobile as well as Wi-Fi. And again, that's available on a regular schedule, which you can look at our website and find the ongoing schedule for the Bookmobile when it's in the community. In addition to using the Bookmobile and using our curbside service, we are doing delivery service. Now that is just for those who really cannot leave their homes and have no other choice. We will bring items out to you. It does take longer than using the Bookmobile or using our curbside service. We had a note from a student who had been visiting the library and was really sad, and the student said, "I wish the library would drop books to our home," and we tend to agree that it's a very nice service to have, especially for those who cannot leave their homes. So if you would like items delivered, you can give us a call at 328-2300, and we'll be able to deliver items to your door. The last thing I want to mention is our digital services. We have an app called Libby or Overdrive. This allows you to access digital ebooks or audiobooks, some videos, and we continue to see a lot more people using this service. Again, if you want assistance in setting this up, you can give us a call and we can walk you through that. We have moved a lot of our programs in the virtual world because we can't gather together. Some of the programs we've had include story time events early on. We've also done some mask making, virtual color time, and this in July, in August, leading up to the election, we'll be doing candidate forums, and those will all be done online.
As always, we invite you to either give us a call or visit our website to see what we have available. You can access our website at rplmn.org or give us a call at 507-328-2300.
Hello, I'm Maria. I am the occupational therapist at ExericisAbilities, and I'm here to tell you a little bit more about our services that we're currently able to offer during these uncertain times during COVID-19. To begin with, we are still offering all of our rehabilitation services. We presently have pediatric and adult physical therapy and occupational therapy, as well as our pediatric speech therapy programs. For our physical therapy, we're able to offer proven exercise to help clients maintain their wellness and be safe at home. In addition, we can help focus on balance through assessment and training to identify key pieces to keep a client safe and prevent falls in their home. In addition, our therapists are skilled in helping with fall prevention and in general home safety to keep our clients safe in the community during this time. Next, we're also able to offer our occupational therapy services. I like to focus on certain aspects that can tend to get lost, especially during these times, which include brain training, which means being aware of how is thinking going. How is your memory? How has it been focusing and concentrating, especially maybe during these stressful times? I can do a standardized cognitive assessment to help identify how thinking is going and then develop a program to help maintain or improve brain health. In addition, OT can look at stress management, and we know that there's a lot of stress going around during these uncertain times, so we can look at what is your coping toolbox and help you identify some tools to manage your stress. And lastly, occupational therapy can look at how have your routines changed since COVID-19? So for some, that might mean that they are not working in their typical work location, or perhaps your gym or place of leisure or enjoyment is now closed. So an OT can help establish some new routines. We also have our therapeutic health fitness staff on staff right now, and they can help with personalized one-on-one fitness training sessions. They are trained to work with clients from a range of disabilities to help them meet their health and wellness goals. They also just offer health and wellness education, including on the topic of nutrition, which can be helpful during this time. Right now, we are able to offer these services in a couple different formats depending on a client's comfort level. We are open for in-person clinic visits. We've updated our cleaning standards to ensure that we are cleaning in between and after every client. We are having our clients wait in their vehicle and we go out to get them. Then we're able to ask some screening questions, take temperatures, and then escort a client directly to their treatment pod to minimize interactions with others. Also, we are able to provide in-home physical therapy sessions at this time. And lastly, we can also offer telehealth or virtual visits if you have a computer and internet connection at home. Some insurance policies have not allowed for telehealth at this time. While most have, please do call our front desk to see if your insurance plan does cover telehealth as an option. I look forward to seeing you and working with you at ExericisAbilities. Please check out our website at ExericisAbilities.org or give us a call at 259-7570. Thank you.
Hi, I'm Brenda Tillman with Family Service Rochester, and here to just tell you a little bit about the work that we've been doing amidst COVID-19 and how some of our services have continued and adapted and changed and certainly expanded. Amidst the whole time, Family Service Rochester has stayed open. We continue to see people for counseling appointments in our office. In addition, we have telehealth services. So if people are looking for some counseling services, we can really do whatever you're most comfortable with, whether it is meeting in the office or a video chat. Some of our other services have continued and, as I said, expanded. One of those is the Meals on Wheels program. And that is a program many people are familiar with, where we're providing hot, nutritious, home-delivered meals to anyone who has a need. So that's anyone, regardless of age or income, who just has trouble accessing meals. We have expanded our services during this time to serve 2 meals a day if needed. So we will serve 2 meals to anybody. During this time, we serve meals 7 days a week. And again, they are hot, nutritious meals. So if you have a need, please feel free to reach out and call us. We'll also tell you that we have adapted some of our services to be mindful that those receiving meals are often the most vulnerable during this pandemic. We have limited the number of volunteers who are delivering. So for example, typically we have volunteers delivering, 7 different volunteers would deliver a route. Each day of the week we'd have a different volunteer. We have changed that, so it is now the same volunteer delivering each day. So it is really minimizing the exposure to the outside world for our clients. And we, like I said, we are again serving 2 meals for anyone who has a need. The other program that we continue to provide is Neighbors Helping Neighbors. And that is really focused on helping older adults stay in their homes by providing a variety of services. We're doing a lot of lawn mowing, we've done snow removal, handyman projects, housekeeping, just a variety of things. And again, that's for anyone who has a need, and fees are based on your ability to pay, and sometimes we can access some programs that will pay for the service. The Senior Cafe continues to be in business, and that is our dining site that was happening here. We have changed, and the service is now a drive up. So you just order your meal, drive up, and pull up to the back of our building, and we bring it out to you. We're hoping to have that in dining happening again outside soon. So I would say if you're looking at that service, please just check with us on our website or Facebook page to see what we're currently offering, if we're offering in-person dining as well as drive up or just drive up. And then the other program that we have expanded is our grocery shopping service. And this is available to anyone who just doesn't feel safe going out to get their groceries. And we have a form online, and people can give us a call, contact us. We go over the list that they need, and we have a volunteer who will deliver their groceries for them. So if you have any questions or are interested in any of our services, I would encourage you to go to our website, which is FamilyServiceRochester.org, or give us a call at 507-287-2010, and we would be happy to help.
Hello, my name is Holly Brown, and I'm one of the staff here at Elder Network. I would like to take the next couple minutes to share with you what Elder Network is still doing to provide services to seniors and their families during this global pandemic time. Please know that Elder Network will continue to serve those in our communities the best that we can using the CDC safety recommendations. Elder Network has been serving seniors and their families in our communities for over 30 years. And we continue to want to serve those who are in need of some non-medical services and or resources the best that we can. Please note that our office is still closed to the public, and we're happy to help get connected to services and get you connected to services any way that we can. Most frequently, we are talking to people remotely by the phone or through Zoom meetings, and making case-by-case home visits when needed. What I'd like to share now is the services that we're still able to offer in a face-to-face manner. Our transportation to medical drop-off and pickup program is currently happening. So if you need a ride to an appointment, please give our office a call and we can walk you through that process. We also have our caregiver companion respite program available for in-home services. This program is ideal for individuals who may need a little help with, say, meal prep, light housekeeping, shopping services on a case-by-case basis. The areas that we are serving individuals remotely would be through our support groups and educational programs. Also, our friendly visitor program. We're currently asking volunteers to call clients on the phone and check in with them, as we know that social isolation has become a huge factor for many during this time. Our caregiver respite program is also doing services over Zoom for supports for caregivers, coaching sessions over the phone, and when needed, face-to-face services for those caregivers who are feeling very overwhelmed and do need that break. Please note that Elder Network is doing everything they can to follow the CDC recommendations for safety and well-being for both staff, volunteers, as well as our clients. If Elder Network can be of service to you, we encourage you to reach out to us at the information provided to let us know how we can help you. We also encourage each of you to continue to stay safe in the many ways that we've been talking about in the last couple months. Wearing masks when possible, making sure to use hand sanitizer or gloves, disinfecting your areas frequently and using hand washing, and social distancing when possible. We want to thank you for your time in watching our video today, and we hope that Elder Network can continue to be there for you and your family when you need it. Thank you so much.